right, let's go ahead and get started. Today we're going to be talking about acne and what the causes of it are and how to get rid of it at any age. And I find this is a top of mind subject for me because I do see a lot of patients that are coming in right now with acne that's popped up out of nowhere. Part of that reason, we're in the middle of the COVID-19 pandemic, and so people are wearing their masks, and that's causing a lot of issues. But this is common for men and women. We see it in our teenage years, but then we're also seeing it later on in life too, and it's a frustrating topic for patients. So I just wanted to cover some of the common causes of acne and what we can do to treat it. This is me. I'm Dr. Kim Harris. I practice and own Prescott Medical Aesthetics in Prescott, Arizona. And we're a full service aesthetic and wellness center. We do a lot of cosmetic injectables and also offer lasers and chemical peels and skincare. And so we're well versed in acne and the causes and treatments for it. So just a little bit of background about acne vulgaris. It's actually the most common skin condition for Americans. More than 50 million people are affected per year, and almost 100% of people are affected at some point in their lives. So this topic speaks to a wide range of people, and it's frustrating because we want to put our best face forward when we're meeting people or conducting business or going about our day. We want to make sure that our skin looks the best that it can. And as far as causes go, we're looking at three main factors. One is increased sebum production. Sebum is what you see underneath the skin when you have an acne blemish. It looks a little bit white. If you've popped it, which most of us have, or seen like Dr. Pimple Popper on TV, you've seen that just kind of like whitish material come out. That's sebum. It's kind of a mix of oil and other materials. And that actually clogs up our pores so that we get those kind of raised areas. Second is a bacteria, and it's a specific bacteria to acne. And then also inflammation. So when we're working on acne, we kind of look at those three factors of what's causing and continuing the acne lesions on the skin. And, if we work on kind of reducing those factors, then we can reduce acne. So, hormones are a hot topic in acne as well. And what's actually happening is when you have certain hormonal imbalances, that increases the sebum production under the skin, and that's what leads to acne. Like I mentioned before, I'm seeing women in their 30s and 40s that are coming in because they just have acne appear out of nowhere. They may or may not have had it as a teenager, but because of certain factors in their lives, they're having more acne breakouts, which seems totally unfair, especially if you had it as a teenager. You're like, I went through this. I shouldn't have to deal with this for the rest of my life. And that's certainly true that you don't have to deal with acne forever. So first, I'm a naturopathic doctor, and one of the main ways that we're trained is to look for the cause of any illness. And so when we're looking at causes, there's kind of four main areas that we look at. Number one, we discussed is hormones. Two is stress, obviously, can lead to a lot of health problems and skin conditions. Diet and hygiene as well. So we're going to talk a little bit about each one of those. As far as hormones go, that's definitely a hot topic right now. A lot of people are looking to improve their lives through hormone balancing, hormone optimization, which we do here. And sometimes, being on hormones can cause acne. A lot of times when our testosterone is too high, you can have an acne breakout from that. and that common pattern, like kind of along and underneath the chin, really signifies like a hormonal acne breakout. So if we suspect that it's hormones, we can run some labs to look at your testosterone and other androgens that are going on. And if they're elevated, obviously that might be what's causing your acne. That's why teenagers get it, is because they have a surge in hormones during that time. So, if you're on hormones, there are ways that we can reduce the acne that you're getting. Or if you're not on hormones, but you feel like you're hormonally imbalanced, then sometimes just running a simple blood test can really tell us a lot. And then we also assess liver function, because all of your hormones are processed through the liver, activated and processed through the liver. So, if you're having liver issues or your liver function isn't optimal, then sometimes just a little bit of supplementation can help that. Stress, the more research that goes on in regards to stress, the more that we see it affects our skin, our long-term health, our vitality, and stress is directly related to the amount of sebum production, again, like hormones, and that can cause and worsen acne. So, making sure that you're taking time for yourself. This is a stressful time for everybody, but making sure that you're taking the steps that you need to reduce your stress. Exercise is a great way to do that, even just walking, writing in a journal, meditation. It doesn't have to be the same thing for everybody, but making sure that you're doing something to manage your stress not only will help your skin look better, but it will also improve your overall health and well-being. Diet. This is huge with acne. So one of the first things that I do for patients if they come in for acne is talk to them about a pro-inflammatory versus an anti-inflammatory diet. And we're looking at pro-inflammatory foods. The big ones, probably the biggest one is sugar. Dairy is huge, alcohol, and then an excess amount of red meat. So, focusing on a more anti-inflammatory, antioxidant-rich diet, which you see here in the picture, we're doing fish, lots of green leafy vegetables, fruits, especially dark-skinned fruits that have a lot of antioxidants and a lot of anti-inflammatory properties in them. And then, some people don't respond to cutting that out. I've had a patient who completely cut out sugar and dairy for 6 weeks, and his acne did not improve. So then we can dig a little bit deeper and see maybe you have a food sensitivity that's causing some of your inflammation and irritation, because commonly food sensitivities are related to what's going on in the skin, whether it be acne, eczema, rosacea is a huge one. And so, we can run a lab test that looks at your reaction to certain types of foods. And, the confusing thing for patients is sometimes it's not an unhealthy food. So you may actually be sensitive to things like the nightshade family, where it's the like bell peppers and different kinds of peppers, which aren't necessarily unhealthy, but they're causing your body some distress. So running a food allergy panel in office can be very informative, especially if you're having acne and other issues, gas, bloating, stomach pain, things like that. Hygiene is a big issue. So we talked about, the sebum production, but also the bacteria that we have going on the skin. And so just making sure that you're washing your face correctly, which most people aren't doing. We're looking at the right products at the right time, getting all of your makeup off if you don't at night, and then using some kind of wash that's geared towards acne really can help. The other thing I recommend for patients is to change your pillowcase every night. If you wash your sheets once a week or once every 2 or 3 weeks, a lot of bacteria and skin can actually build up on your pillowcase. So I recommend that patients just buy enough pillowcases to change it every night. And that I have seen make a huge difference as far as acne goes. You want to make sure that your face is clean and anything that touches your face is clean. All right, so let's talk a little bit about treatment. So first line in our office is to get patients on a really good skincare regimen. So if you've been in to see us, you'll know that Epionce is our product line of choice for several different reasons. One, it's a really clean skincare line. They don't have any fragrances or parabens or phthalates in them, so there's no endocrine disruption going on with these products. They are professional grade, so we see great results with them. And then they have a little bit of a botanical focus to them too. So we see a lot of anti-inflammatory properties with the Epionce skincare line. And that really helps reduce irritation, inflammation, and redness in the skin. So I know for myself, I've seen a lot of improvements in just the color of my skin tone when using a lot of these products. So they formulated 4 products that are specific for acne. The first one is the Lytic Gel Cleanser. Smells amazing, and it has botanically based antibacterial properties. So that's actually probably our most popular cleanser. It really helps strip away any oils, is great for makeup removal. And then the antibacterial part helps with the bacteria that's present in acne. The Light Facial Lotion is a lighter moisturizer. And I just did a dermatology conference this weekend, and they were talking about acne and how patients will, because they feel like they have too much oil, and so they'll strip everything away and then not replenish the moisture that needs to be there. Our skin needs some moisture, but people are like, I'm oily, I need to get rid of all that oil. And so we really like this lotion for acne because it's a lighter one. It doesn't have a lot of oil. It's not heavy, but it does help repair your skin barrier. And that's really important in this process of, reducing the acne. So get rid of the oils and the bacteria, but then we need to replenish that skin barrier so it stays intact. It doesn't cause further issues. The Lytic product, just a Lytic TX, you use it several times a week. That actually works a little bit like a retinol type product without being harsh or irritating. So it's good for patients that are already a little bit irritated, but who do need that cell turnover. Because what will happen is if we have sebum, those little lesions underneath the skin, but then you have a lot of skin over the top of it, your product's not able to penetrate. So the Lytic helps gently turn over the cells on top of on the very top of your skin that allow the products to work better. And then lastly, we use the Purifying Spot Gel. And that is just a rescue spot treatment for when you're having 1 or 2 acne lesions on your face that you just need to work on, and that you just rub in. It actually has some sulfur in it, but it doesn't smell bad, and patients really respond well to that. So the 4 of those together are what make up kind of the basis of our acne treatment. And then we also recommend regular peels. So, I talked about the cell turnover with the Lytic treatment in the last slides, but what really can help boost your healing up to the next level is starting to do a series of peels. Now, if you've had a consultation with me, you know that I say everybody needs Botox and peels. That's foundational in our practice because, we want to work on getting rid of fine lines and wrinkles, but we also want to work on the surface of our skin, and that's what peels do for us. So, the nice thing about the peels that we offer is that we have a range. We have the VI peel, which is a really deep peel where you sheet peel, and it's a little bit ugly, honestly, but great results. That's what's going to help you progress faster through your treatment plan. But not everybody's down for, having 3 to 5 days of downtime where their skin is peeling off. So we do offer 2 of the lighter peels from Epionce. The Light Lunchtime peel actually has no downtime to it. That one you can come in, get it applied, go back to work. That helps with skin tone and texture. Again, we're taking off some of those top layers of skin in a gentle manner so that your products can work better. And then we have the Sally Mally peel, which is a mid-grade peel. That one you do get some skin sloughing, but not a lot. So typically patients just look like they're a little bit flaky or dry for a few days. So that is integral to our treatment plan for acne, skincare, and peels. There's, a lot of supplements available out there for acne, but I find it can be hit or miss with patients. So, if your acne is not caused by hormonal, then the supplements that are kind of geared towards hormonal acne are not going to help. So there's a lot of different ways that we can approach this, but sometimes it does take several tries with, looking at supplementation and trying out different things that help different patients. So I do have kind of a few set protocols for patients that are helpful, but really getting a consult with us and coming in and, seeing what's right for you because of this wide range of what causes acne, what's going on with your skin, your age, your hormones. So, making sure that you're getting the right supplementation for you so that you're not wasting your money is important. And then, there's conventional therapies, which we don't do a lot of here. There's antibiotics that can help, topical and oral. Benzoyl peroxide can be a little bit harsh. But, if you're looking at really severe acne or it's affecting your day-to-day life, then looking at conventional therapies might be appropriate for you for a little while. But, we really have seen great success with patients that are willing to commit to better skincare, peels, and then possibly some supplementation. Lastly, I just wanted to talk a little bit about acne scarring because this is it's a long-term consequence of acne. So, we can get acne just from really we can get scarring from deep cystic acne, but we can also get it from picking. And, it can be embarrassing and debilitating for patients. So this is a big issue for a lot of our patients that come in. And we do offer treatments for that as well. So peels can be helpful. They're not going to completely take care of it. But if you do peels along with microneedling, you're going to see amazing results. I'm going to show you some before and after treatments and with really minimal downtime. So laser can also be used for resurfacing. The laser genesis in our office is kind of a gentle way to work on some resurfacing, or injectables as well, things like Sculptra, or a lighter filler can help fill in some of those deeper acne scars after we've done some resurfacing treatments. So this is just a look at what kind of results we see with the skin pen microneedling. It takes about an hour total. The nice thing about skin pen is that the downtime is really minimal. So you look like you've had maybe a light sunburn for about 48 hours, but you can see what amazing results this patient has gotten, reducing inflammation and redness in the skin, and then also reducing the look of those acne scars that are there. And here's another great example of what kind of results we can see with skin pen. So this is 5 procedures, and you can really keep going until you're happy with where you are. Or for this patient, I would recommend probably some Sculptra underneath that can help really smooth out the rest of those little pock marks that he has going on. Again, a really nice treatment, minimal downtime. Patients are really happy with that service. In conclusion, I just want to say that acne is difficult. It's not like there's a one-size-fits-all treatment for acne patients. It really depends on how healthy you are, your diet, how you take care of your skin, genetics, hormones. So if you're not satisfied with the acne treatment you're doing for yourself at home, we really recommend that you come in and get some expert help because there is so much that we can do here for you for active acne, for acne scarring. Elaine is wonderful at, counseling patients on skincare routines and peels. She gives a fabulous peel, so I can't recommend her highly enough. And so we're going to run some specials through the end of February. If you buy all of our 4 acne fighting products, you get 20% off the bundle. That's the cleanser, the lotion, the lytic treatment, and the spot gel. Or 10% off any microneedling procedure. And those specials are going to be good through the end of February 2021. And as always, if you have any questions, you can give our office a call at 928-277-7414. And our website is www.prescottbotox.com. And I'm just going to leave it open for any questions. So I'll be here for a few more minutes. If anybody has any questions, just go ahead and write it in the text box and I'm happy to answer. Thank you for joining us.